Welcome to Season 5 of How I Made It Through, and thank you for joining us. I have invited Ray Catania, author, metaphysical teacher, and coach, to join me as my co-host as we aim to engage, challenge, inspire, and teach you, our listeners, what it really means to be a spiritual being having a human experience. We'll explore not just concepts, but attempt to unravel the neuroscience of metaphysics, as well as practices designed to expand consciousness, increase healing, and develop a profound connection to love. We'll explore God, death, the afterlife, and pushing past limitations as we encourage you to break free of the trance of fear so that you may experience greater freedom, peace, and connection to yourselves, each other, and spirit. Today, our guest is Dr. Tara Perry, and she is a clinical hypnotherapist and doctor of acupuncture and Chinese medicine. She specializes in core trauma transformation, helping people get to the root of their biggest block, connect to their authentic selves, and thrive in deep, confident peace. For 25 years, Dr. Perry has successfully treated celebrities, Olympians, first responders, world record holders, doctors, scientists, teachers, parents, and children. Clients suffering from anxiety, PTSD, stress, trauma, addiction, pain, insomnia, and a variety of other challenges have discovered the power of their subconscious mind to heal better and faster than they thought possible. Dr. Perry has been featured on Lifetime Magazine, Esquire Magazine, UCLA Bruin, Fox Sports West, Wall Street Journal, Cosmed Magazine, Travel Host Magazine, and many more. For 10 years, Dr. Perry taught at the #1 acupuncture college in California. In 2000, she was chosen to be the first acupuncture teacher at the famous Arthur Ashe Center at UCLA. Dr. Perry hosts her own podcast as well, which is available on all major platforms and is called Next Level Healing. So great to have you. Welcome.
So much fun to be here. Thank you, guys.
Yes. Well, I always like to start at the beginning. This is when people do such brilliant healing work like this, what drew you to this? How did you get started? Tell us a little bit about your story, if you would.
Gosh, I feel so lucky. I feel like source is out there, and if you tune into it, it can guide you. So after graduating UCLA, I went to work in the film business, worked in various areas of that, read scripts for a living, and ended up at the most powerful talent agency in Hollywood. They're still extremely powerful. At the time, it was pretty undisputed. And after 2 years, I felt like I was suffocating. It didn't feel like what I wanted to be doing for my life. And so I called it my homeopath, and I said, what would I do if I want to do what you do? Because I was really impressed with how he healed people. And it was just crazy that I was leaving this place because we literally had lawyers and MBAs in the mailroom working for minimum. I know, it was nuts. But I always say decisions are easy when there's no alternative. And so I called it my homeopath, and I said, what would I do if I want to do what you do? And when he answered the question, it's like God parted the clouds and said, okay, this is what you're going to go do. I mean, it was crazy. It was nuts. But I followed that. And then I ended up going to China for a year to study at one of the top 5 traditional Chinese medical hospitals, finished up my training at one of the top schools in Los Angeles, ended up teaching at UCLA. And, really just love this path. I like helping people get to be better, freer, happier people. I really like to give people their power back. I see in medicine a lot of times people are giving their power away.
Mhm.
And I think that's deeply, deeply regrettable in lots of cases because they're not getting the outcomes that may be available to them with other means.
Yeah.
So let's see, have I answered that question enough? Sure.
Well, that's a pretty darn good question. Or excuse me, it's a good question and good answer. It's so interesting. So film school to becoming a healer.
Yeah, I was actually a communications major at UCLA. So my first job out of that was learning how to read scripts for a living, movie scripts, television scripts. So I did that for a number of different companies and, got some great responses with my great feedback from what I contributed to that. But then again, after having spent 5 years in that business, I wanted to be in an area healing really called to me.
Yeah. Let's just dive into the subconscious mind because that's where it's all about. Tell us what you know, what you've experienced. Just Get us going, if you would.
So after 23 years of kind of standard acupuncture and nutritional medicine, and it's funny because I would muscle test on people. I just like, is this a mental, emotional, physical, spiritual answer? And most of the time it would come out to be like a spiritual, which I thought was really interesting. So it just felt like there was, if I could get to the deeper root of something, and Chinese medicine is all about treating the root. And when you realize, as scientists now know, that your conscious mind is only processing about 40 bits of information per second, and your subconscious mind is processing 40 million bits of information per second. Yeah, I know, astonishing. So, I mean, I have been blown away. It's like one fellow I worked with, and he was an advanced meditator who I met his wife in the Joe Dispenza community. And he was all excited when he found out I was an acupuncturist because that had alleviated his back pain that he got 40 years ago, breaking his spine in a motorcycle accident. And I said, you've done acupuncture, you've done chiropractic. Why don't we go to Command Central here, your subconscious mind, find out what's getting in the way of your healing? Because if you break your femur, which is the thickest bone in your body, if there's nothing obstructing that, it should be healed better than ever in 8 weeks. So he said, great, sign me up. 2 sessions, he doesn't have the back pain anymore. I know, it's crazy. So, I mean, there was just so many feedback responses like this that I thought, okay, I this is what I want to do all the time because why wouldn't I?
Yes.
And kind of the way I approach it is if there's an emotion that you're rubbing up against, and it might be not feeling worthy. That's a really common one. And the great thing about all this stuff is it's not your fault. We learned stuff usually between the ages of 2 and 10. And sometimes I feel like I get to let people out of prison for a living because when you're jailed, by something that your subconscious mind picked up between the ages of 2 and 10, that's typically the range. I mean, sometimes people go back to being in the womb, sometimes they're, younger than 2, but I would say the vast majority of the time it's between the ages of 2 and 10. It's holding you captive if you're feeling like you're not enough, you're not worthy, you deserve blame. You're forfeiting what God, the universe, source, really wants for you, which is so much more
Mhm.
than that.
Mhm.
So by being able to go in quickly and easily to identify, what got cemented in, why did it get cemented in, what does it want, what does it need, and then turning it around because it's trying to help you. The subconscious mind prefers the mind prefers a familiar hell to an unfamiliar heaven. So that default that's been wired in there over and over and over again, last week, last month, last year, last decade. I mean, people can go through this easily for the rest of their lives and not solve these issues if there's not something that intervenes and says, "Hey, you're not an iPhone 4, you're an iPhone 16, and there is an upgrade for you."
You know what? Whoa, God, you're speaking to me so powerfully. And the most the way I feel like sometimes I can get really stuck because the metaphors you're using are so powerful and I experience them even in my own life.
Yeah.
Ray, without, sharing any of the details, you had the experience. It feels like we need to
I
pivot to
did.
you a little bit.
Yeah, and it was wonderful, I gotta say. So, in the beginning, when we first started working together, Dr. Tara and I,
Well, Ray
um
was on my podcast, so that's
that's
how
right,
that's how we met.
that
Okay.
is how
And
we
and
met.
his story is amazing, and I told all my people about him, and, I love connecting with inspiring people, and Ray's definitely one of those amazing people.
Thank you very
Absolutely.
much. And we were talking, and this was off camera, of course, about some different things and that we had encountered with, just talking about some of the people that we've helped and how we've helped them. And, there was something that I was kind of stuck with and I was, working through. And I mentioned it to her and she says, well, why don't we just do a session? Why don't we do a hypnosis session? And I was like, well, that scares the crap out of me.
Exactly.
The whole thought of, just what might I say? Who knows, right? So, but we did it and it was, I have to say, incredible. It really was. I followed the instructions as I was supposed to, and we really uncovered some stuff that I probably would still be struggling with had I not done it. And it really was simple and not scary, by the way. So,
I'm really glad you're saying that, especially men. Men more than anything can't stand therapy. In fact, I think I own the domain name non-therapy therapy. I'm one of those domain junkies that whenever I hear something, "Oh, that sounds good, I'm gonna buy that."
yeah, the beauty of it is I barely experienced negative part of it, right? Because
Yeah,
I'm half there, half not, and
exactly.
it doesn't hurt as much as when you're actually, expressing these sort of things. So
But I
it
always say
makes sense.
people, you don't have to go back and relive the experience, you're just reviewing it.
Mm.
I often
Mm.
describe it as like you're sitting in a movie theater, you're looking this great, you might see things, you might hear things, you might just have feelings in your body. And the other great news is there's no wrong answer. And the right answer will bubble up and there's nothing to figure out. There's a pattern that just becomes clear.
Wow. So how long is a typical session?
2 hours, I allow 2 hours. It doesn't always take that. I think Ray passed, I think we got through yours is really quickly. I allow 2 hours. Some occasionally they go over. I mean, it's kind of like going in for dental work. You really want to go in and out as fast as possible. It's not, you're not looking at the clock going, okay, this is really great. Let's spend more time here. It's like you want to
Mhm.
identify the problem, fix it, and kind of close it up. It's almost like having psychic surgery and bring it in, take care of it, and
Mhm.
get out as soon as possible.
Mhm. So you're
So
getting
Surgery, I like that.
and I work with people typically over Ray was an exception. I work with people over 90 days, 3 sessions, because I typically find there's layers to things.
Right.
And I don't wanna do somebody the disservice of just, taking a chunk of it away and not getting everything. So I do work with people that have an 8, 9, or a 10 need to change and an 8, 9, or 10 commitment to change. It does take the commitment. It's like, learning a language, learning a new sport. It's not hard, but you have to do the daily work. It's just and Ray, do you wanna comment about that? What
Yeah, I mean, it's not difficult at all. You just have to be disciplined to do it because it's the type of thing just like working out and going to the gym. The more you do it, the better the result, and it's always that first time, when it hurts, and then you get past that hurt in a few days, and then everything gets better, and it really, really a great analogy because it's kind of the way it works. When you first come out of the hypnosis, you're not feeling wonderful because of the fact that you just, went through some of the emotional traumas, right? But you don't feel terrible either. And then it gets better progressively day by day by day. And that stuff starts to just kind of fade away more and more and more. And that it's kind of like, the vision, the thing that, you want to see, that you wanted to have, it just kind of opens up and you're just more fully present. You can just see it. It's the best I can explain because, that's as much as I understand of it,
So
but,
what
it
was
was
the
really good.
experience of life before doing it and, like, 30 days after the experience? How did your just quality of life experience change?
Things actually that we discussed came to fruition and are coming to fruition. Boom, boom, boom. It's just like one after another. I mean, it's been yeah, it's been crazy.
Yeah. Well, how
Definitely doing
again,
it total celebration dance, yeah. I'll share
That's
our
my Snoopy dance. I
because
love doing my Snoopy
it's
dance.
really good. Yeah, it's been incredible.
Awesome. I'm so happy to hear that. Yeah, business people who, might be suffering whatever the block is, procrastination, unworthiness, whatever it is, it gets expensive over time to not be performing at your best.
yes.
Or like I just worked with a gal, high performer, but, has a stressful situation, and so, her self-medication is to go shopping, and we fixed that issue, and, she's already saved, 60 days into the program, she's saved, anywhere between 10 and $30,000.
Cool.
Just, on stuff she didn't really need to be buying, and now she's got and I hear over and over again, people get good boundaries with this. They start to develop better discernment. So things that are not working out well for you, you kind of start automatically repelling those, and things that you benefit by, you become more of a magnet to, and you become more fine-tuned to that kind of stuff.
I want to break this down a little bit. I'm loving this so much because I think so much about thoughts, feelings, and beliefs, but beliefs, and when you talk about the small portion of our mind that is actually conscious versus the sea of unconscious mind that really shape our beliefs, we can say, I believe I'm powerful and worthy and wonderful. And the subconscious mind is, I am 7 years old and I am none of the above, right? So you've got the hypnosis session. You're trained to move through that, identify the block, and then there's homework.
Well,
What is
I give people an audio at the end of the session. So once I can see that pattern and the thing that's tripping them up, we give them an audio to fire and wire the neural pathways from the iPhone 4 to the iPhone 16. So as they're drifting off to sleep, they're just listening to that. It's about 10 minutes. You don't even have to be conscious for it. Your subconscious mind will hear it. And then I give them a high performance planner. So I need them to spend just like 3 minutes to just note down the 3 shifts that are occurring, in the direction that they want. And those things, that's a free for all. It can be I'm sleeping better, I wake up feeling better about myself. It can be I'm smiling at more people are smiling at me. situations that were challenges are all of a sudden freeing up. I mean, I don't know what it's going to be. It's your life. But you have to notice them because I can't tell you, before I had people doing that, I worked with a gal that, I said, okay, I'm giving you a magic wand. What's the issue that you'd like to resolve? Now, this woman was in the real estate business, and she said, well, I'd like to stop second guessing myself in every single social situation. That's a problem if you're in the real estate business.
Heck yeah.
So I knew her, and I knew that her background there was a lot of stuff there. And so we just went back, rewired it in one session. And I called her up like 2 months later, and I had a hard time getting a hold of her. I'm like, wait a minute, are you not wanting to answer my, because I think I left her some text messages. It's like, on a scale of 1 to 10, because I'm always getting that 1 to 10 scale. I need that for feedback as to how I'm doing. And I thought, you know what, if you didn't listen to it, if you didn't, whatever, if you got no, just let me know. And when I finally got a hold of her, she says, oh, yeah, that's gone. Yeah, I guess it was 100%.
She just didn't even remember it.
Well, but I can't tell you again, people, there's this wonderful book called The Gap and the Gain. And in our society, we're totally dopamine driven. Dopamine is the molecule of more. And there's a great book on that too. But we're always focused on the horizon. And if you don't look back, last month, 3 months ago, 6 months ago, last year, and go, oh, wow, I've covered a lot of ground, and then give that pat on your back to your nervous system never gets the message that it's doing well. And I always say the nervous system is like a puppy dog. If you have a puppy dog and you beat it with a newspaper all the time, what kind of dog is that going to grow up to be? It's going to cower in the corner. It's going to be neurotic. It's going to pee on the floor. But if for every, little scolding you give it, like, no, don't chew on the furniture, you give it, bounds of praise, it will do anything for you. So our nervous systems are a lot like that. But like you just said, Kristin, if we've got this thing going on in our subconscious mind that's going, you're bad, you're not worthy. And I cannot tell you how ubiquitous this is. I mean, this is like present in all of us. I don't know what it is about our crazy society, but that's common to all of us, myself included. I mean, I can't tell you how much I beat myself up for decades. And if I had had this done to me when I was 20 years old, my quality of life would have been exponentially better. Exponentially better.
Yes.
Because I wouldn't have had the blinders for so long.
But I feel that.
When I listen to the tape at night and you get to the part where you're just kind of saying kind of how great I am.
I think to hear.
I'm like, yeah, it really is. That's what I was like, this is cool, and you're just drifting off hearing how awesome, it's very good. It's very cool. It's not uncomfortable.
But it's not, but you speaking to your fish, your fish. I was going to tell you, okay, speaking to your thing about your little kid in there going, no, you're not, no, you're not, no, you're not. I have this wonderful slide on my slide deck, and it's a big fish that says, you're not worthy, you're bad, other people get relief, you don't. And then there's all the little fish like you're going, yeah, I'm good enough. Yes, I make enough money. Yes, yes, yes. And so the big fish is eating the little fish all the time before they get a chance to grow up. So the trick in all of this is to get the subconscious mind to see that those things are actually true.
Mhm.
I'm going to ask a wild question. If you have all this training at a high level or at a discrete level, how? So you get into a particular brain state and relaxation. Can you tell a little bit about the magic behind it?
Yeah, that's challenging because it takes thousands of hours really to learn how to do right.
Can you just say it in a sentence? Sorry.
Well, there are things that, I mean, Ray is ultra accomplished, and it just didn't take much of knitting those things together. You need to go back and talk to the part that's hurt. Find out what it wants, what it needs, what it's trying to accomplish. And then I own the domain name Brain Aikido. You know what Aikido is?
Yes, I do.
You don't fight something with force. You pull the force towards you and you turn it around in the direction that you want. Mental Tai Chi, I own that one too.
Like,
If I ever need a domain, I'm going
where's the to go to?
Because I kept thinking, well, what's the thing I need to, what is the secret sauce I need
Yeah.
to tell people how this works? And it's connecting to that injured thing, finding out what it wants, what it needs, and then there's not just one way in. It's like you're looking, the person's built up a dam and you're looking for the crack in the dam that allows you to get through.
and she makes you do it, right? Like
And
she's not telling me, she's asking me, and I'm answering the question.
so there's prompts. You can prompt people to ask them to, fill in the blank, da 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 da. but you're constantly looking, and there's different ways and different angles to do that. So it's not a recipe, one size fits all
Right.
type of thing. It's like
You're
you learn.
exploring.
It's like, I feel very blessed because I've learned by some of the top people on the planet. Tony Robbins, whether you like him or not, there's a reason he makes $1 million for 8 hours of his time. Marissa Peer, I trained personally with her. She won the Best Therapist of Britain award. Joe Dispenza, I'm a huge Joe Dispenza nut. Anybody that follows my stuff knows, I'm going to my 10th live event with him in December. So the brain has ways that it works. In fact, I do with anybody that works with me who's willing, I do have them working on the heart and brain coherence and meditation as well, because the outcomes for that are scientifically so incredibly proven. So it's very customized for that person. Some people, they have blood sugar issues and they need to get those under control. Some people don't sleep well at night. So, that's an issue. And an outcome of this is that people do sleep dramatically better. Ray, did you find any difference in your sleep?
Yeah, I just drifted off. Every time I would listen to it, I would wake up and it would be the next day. So there was literally, I don't know if I fell asleep first or the recording ended first, but right after it, I would be out. Zonked out.
Because I've worked with people that haven't slept well for 7 years and only slept 3 to 4 hours a night, and they had been through regular sleep therapy and it didn't work. And they're like, I don't know how you did this because you didn't even mention the word sleep in the process. I didn't have to. I just had to eliminate the emotion that was preventing her from sleeping in the first place.
That's it. Yeah.
Wow.
Well said.
Oh, I have so many people that I need for included. I mean, just all these
Right.
people are popping up as I'm listening to you. So when I think about hypnosis, and you were saying Ray, he was just this wonderful client who was so quick to connect to it. What do you find in terms of personalities or traumas or issues where someone is really primed to just dive right in versus those that might experience some resistance and maybe require more?
That is a great question. I love working with nurses and the military because they're really good at following instructions. That's really what it takes.
Okay.
It's the people that, they kind of go off and invent their own thing. And we're talking about a very, very small percentage. I would say 95 percentage people do, get rid of 50 to 100% of their issues in the 3 sessions. Um, I had a guy in the military, he scored 100 on his PTSD scores. His aunt gifted him my program. He had done the military stuff. He was still having panic attacks, still not able to focus. And after 2 sessions, he said, he said, it can't be this easy. And I'm like, yeah, it actually can be. So, well, again, we're talking to that subconscious mind that's doing 40 million things per second. I mean, that's an amazing machine.
Yes. Oh my
So
gosh.
trying to solve things with our conscious mind is, it's just,
Yeah, it's like trying to build a house with just a nail.
yeah.
Oh my
There's a
god.
line I use in my work a lot. It's like, if you were seeing a child trying to dig a hole through the side of a mountain with a plastic fork and a plastic knife, you wouldn't go over and kick it and tell it how stupid it was. You'd
Yeah. This is revolutionary. Why are we not all talking about this? Why aren't we saying screw the,
yeah,
cognitive reframing and let's just get to the
I'm
heart of the
so glad you're
matter?
asking this question. So one of the slides in my slide deck also is one of my favorite MDs is Dr. David Perlmutter, and he teaches MDs all over the world. He wrote Grain Brain and Drop
Mhm.
Acid, but he says it takes 18 years for good information to get into mainstream medicine. I mean, it's just shocking. It's a machine. Unfortunately, in my opinion,
It's
it's
business.
structured to sell drugs and surgery. And it's not, I believe they've even publicly said, healthy people are not a good business model for them.
Well, that's right. Yeah, it's preying on the people who are sick and it perpetuates this
But what
thing.
I love is that there's now this whole other stream of medicine or stream of information that's occurring, like in your podcast. People are getting other avenues. I've got friends that are down in Mexico studying the effects of ibogaine on, restoring the nervous system. And if you listen to Nolan Williams, he's a triple boarded MD. He's a triple boarded MD psychiatrist. That's like the 14 years of full on
Mhm.
stuff. So he's got amazingly good credentials. And, if you listen to his talking about the research, it's like number one thing for traumatic brain injury, but you can't get it here in the US. It's a shame.
It's a shame and it's insane. So what do you think about, and it's not about bad mouthing, but it's about understanding because right now,
Mhm.
the gold standard, at least to my awareness, which I admit is probably very limited, but if someone has complex PTSD, it's EMDR.
Mm. Well, I did EMDR years ago.
Mhm.
I didn't find it did much.
It didn't do anything for
Yeah,
me.
I didn't find it did either. And again, I'm not bad mouthing either. I like results.
I'm big on results.
And honestly, if a result is taking a potato and rubbing it on your elbow, great, do that. So yeah, minimize any kind of risk and maximize the results. That's what my whole life has been geared towards.
And there's all this evidence, and now there's documentation, and it's creating like this is evidence-based results so that it can be indisputable if you get enough.
Yeah, and it's hard to get the studies because they're not funded. And
Mhm.
unfortunately, I mean, I hate to say it, but we're living in a time where money predicts a lot of outcomes for studies.
Yeah.
Because you can hire people. They can. There's a lot of shenanigans that can go on with studies.
Yes.
I love people like Dr. Joe Dispenza, who one of the reasons I adore him is that he is, getting all the data on what's happening to the microbiome. I was in his microbiome study 2 years ago, and the scientists who didn't give him the time of day, before he started cracking the surface on all of this, now they're like sitting in his lap panting because they're going, there's no drugs that do this. This is 3 times more effective than any drug for pretty much almost for 60 different, health conditions that are, we're talking some of them are cancer and, PTSD and stress and anxiety and all kinds of stuff. So I find that works extremely well with what I do. I've worked with a lot of people who do that work. It takes a lot longer. It takes a lot more time, energy, and focus. Getting to a live event is, hotel, transportation, a week off of your life, and additional funds. So I do, I love the work that I'm doing because it's just such an elegant way to get into the subconscious mind, rewire some things, and then, have people experience better quality of life.
Yeah. Do you ever work with people with autoimmune stuff?
Oh yeah. So my again, what I typically say to somebody is there a feeling that you don't want to feel anymore? Is it, just you're worn out, you're exhausted, and, there's no reason? Typically, that's because you've got tapes playing in your brain. You're not good enough. The world is overwhelming you. You don't have the resources to survive, whatever that stuff is that got plugged in there when you were a kid. So that's exhausting. And okay, the sympathetic nervous system and the parasympathetic nervous system. If you're stuck in sympathetic, which most of us are to some degree, then your hormonal system is not optimal, your digestive system is not optimal, your immune system is not optimal. You need those things to be firing and wiring at their fullest so that you can heal. So I've had people who've had crazy things like, mast cell inflammation and babesia and Lyme's disease and allergic to all but 5 foods.
Yes.
And they were going bankrupt because nothing was solving their
Yeah.
problems. They were doing acupuncture twice a week, neurofeedback, biofeedback, blah, 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 blah. And it is exhausting and it's frustrating because, you're losing it feels like you're losing your life.
Well, it does. You're so disempowered. My best girlfriend started with rheumatoid arthritis, and then they put her on steroids, and then it just the compounding of symptoms and problems and interacting medications, it's like her life is just crumbling before her. And then people don't believe her. They tell her it's all in her mind, and she's
Yeah.
going, I can barely function.
Yeah. So these things require a lot of teasing out because sometimes there is a infection component, sometimes there
Mhm.
but if you get the mental component firing and wiring at optimum, it's amazing how much drops away.
I'm going to be making some introductions.
So, like, grinding is one, because if think about it, if you're a kid and something amazingly stressful is going on in your life, what are you gonna do? You're gonna tense up, you're gonna grind your teeth, and you're
Mhm.
gonna get a headache, and you're gonna get a migraine because of all that tension that you're holding in the upper part of your body. So if you
Yeah.
go and you fix that message back there that you're in danger, you have to, become invisible or, clam up and, you know what clams do, they clam
Yeah, no,
and the clam well, being an adult clam is exhausting, and it doesn't help you in work, it doesn't help you in relationships, it doesn't help you succeed. So
Wow.
so so the magic is letting go of the old garbage that you've been carrying on, and it's just nuts. I mean, like, I was in a training class, and I was with somebody who had sort of unearthed well, she knew she had been through amazing trauma, but when we were doing this hypnosis to help her just let go some of that, she was processing quite a lot. And so for her to be doing a session on somebody else, I was trying to make it easy for her because I knew what she had been through as a child and it was horrific. So I was like, okay, I try and pick something easy. Like, okay, I'm late a lot, so let's do that one because when it was her turn to work, of course I go back to something that I had all but forgotten about, but it was extremely traumatic to me at the time, and I'm sitting there bawling my eyes for a situation that I had pretty much all forgotten about. But
Yeah.
my nervous system hadn't forgotten about it.
That's right.
It was still part of my unworthiness message to myself.
Oh, wow.
I'll tell you a great little side effect that occurred that was completely unexpected. I have an injury in my neck, and it just recently, I guess it got worse or whatever, a herniated disc, and it must have shifted or something. And so I was dealing with a lot of chronic pain, but we didn't address that. But the pain, now the injury didn't fix itself, but the pain is gone, which, yeah, we didn't, that wasn't even something that was in there.
And I get that a lot because once you've dialed back the sympathetic into the parasympathetic and you've got the, wherewithal to heal and you're not doing this.
Yeah.
And that can be, totally subconscious, just patterns of holding stress in your neck or your shoulders. Or I can't tell you how many people I've worked with that used to go to acupuncturists and chiropractors all the time. And just in a couple of sessions, they're going, oh, I'm not carrying around that weight all the time. That's another analogy I like to use a lot. It's like you've been carrying around a 150-pound backpack and you just get to dump it.
Yeah. Exactly.
So our show being our show, I want to ask, with your lifetime of being alive, as well as this work and all of your experience, how has it shifted or expanded your spiritual connection? What are your beliefs around that?
I love that question. I'm totally spiritually oriented. I mean, I live for that. I love helping other people. Really, nothing lights me up more. I love nature. When I'm doing these incredible meditations, it's like you're lighting up the energy centers, and that's that. I mean, that's why Joe Dispenza named his movie Source. It's your connection to that amazingness, and there's just nothing more delicious than that. And when you're connected to that, I interviewed Mark Gober a while back. He wrote An End to Upside Down Thinking, which is all about how consciousness is not located in your brain, and he proves it. He takes all the studies that I've known about forever and makes it so a 10-year-old could understand it. Ray, did you interview him as well?
No, but
Okay.
I'm very interested in all of his work. Yeah.
Yeah. So he takes all those studies that I had known about, and then just put them together so elegantly in a way that a 10-year-old can understand it. But he proves that consciousness is not located in your brain. And how does he know that? It's like, well, precognition couldn't be explained otherwise. You couldn't have all these near-death experiences, Ray. How do you explain all the veridical
Mm.
near-death experiences? I mean, it's one thing to say, okay, some of these people were sort of dreaming and imagining. I've also interviewed Eben Alexander. Ray, have you interviewed him?
I know him.
He's the neurosurgeon who was more
Mhm.
brain dead, arguably, than anybody, and wrote about it because he's like, "Look, my brain was offline. There's no way I could have had this more real than real experience, with having no brain function."
Yep.
And then you have people that, like, they go out of the hospital and they identify things on the roof. I mean, crazy stuff. Yeah. Children being born with full recollection of previous lifetimes,
Mhm.
and all the stories don't have to be true, but if even a handful of them are true, and the University of Virginia has gone to a great length to
Right.
study all this stuff, precognition, and there's just so many pieces of information that don't fit the Newtonian model. So with that model being accurate, then the implication is that we're all swimming in this amazing sea of consciousness and energy and frequency, and what is that, and how do we make the most of it as a collective on this planet? So yeah, that's my
And it's so much
research.
fun tapping into that.
It is a great deal of fun, and when you're
Change.
constantly working to upgrade yourself, upgrade your frequency, which involves giving to others. It's not a selfish, you can't live that path selfishly, because when you
Right.
treat somebody else when you treat somebody a certain way, you're actually treating yourself that way.
Yeah.
Mhm.
Because we're all so interconnected. You can't do that anymore.
Yeah. Yeah,
Yeah.
you can't go to bed at night if you're not helping others.
Yeah. Oh, it's so good. It's so good. So I'm assuming because you're in Tennessee and raised on the East Coast, people can work with you remotely.
Yes, I actually was 30 years in Southern California. I had my office in Santa Monica, Beverly Hills, and Belmont Shore, taught at UCLA. And then COVID came along. For me, it was a blessing because it forced me to get really, really serious about, what mattered the most, and also more than encouraged me to go virtual.
Yeah, of course.
So now I work with people all over the world, which is a delight because, all those travel restrictions and expense and, all
Yes.
of that's just gone. I literally do work with people all over the world. If they're within an hour and a half radius, I just have them come see me here at my house because I love to see people in person when I can.
Of course.
But it really doesn't make any difference because their eyes are closed.
Yeah.
As long as I can see, if I can see them clearly, we don't have internet failure and stuff like that. And if there was an internet failure, again, this is a very natural state that you're in. It's not, people have this crazy idea about hypnosis that, you can make somebody do whatever you want them to do. And that's all garbage. I mean,
Mhm.
Ray, if I had told you something that was unethical or,
I've had chicken. Yeah.
What was it?
I would have really get the hell out
or
of it.
you're going to get this overwhelming desire to write me a check for, $1 million. What would you'd open your eyes and you'd go, okay, this is fun. Thanks. Bye.
Yeah.
So it's not like, it's a willing participant, you're in a relaxed state. So your alpha waves are more available, possibly even the light theta waves so that you have access to go in and find out, obviously you want to work with somebody that you feel comfortable with, that trust. And
You're
because-
not that out of it that you're completely out of it.
Yeah.
Oh, that's why I say it. You're like half in, half out, kind of. Like
It's
you're
a daydream.
cognizant to a
Daydream.
degree. Yeah, it's like, yeah, a little deeper than that. But
Yeah. Or coming in and out of sleep, which
I
is
mean,
why which is why people don't always remember the session. And so, actually, in Ray's case, this is great. You thought only 20 minutes had gone by, right? When you came
yeah,
in?
yeah.
Yeah. And it had been like an hour and 45 minutes or something like that. That's very common. Time dysmorphia is very common in these states.
Sure. I have the feeling, because I'm even curious about this. If someone wanted to do your work, not the acupuncture, the Chinese medicine, but they
Yeah.
really just wanted to work with the subconscious mind, they wanted
Yeah.
to be trained as a hypnotherapist,
Yeah.
what is the educational path, length of time?
Well,
Can you share more?
that's a great question. And again, I've studied with three of the top people on the planet because, like I mentioned, Marissa Peer, Tony Robbins, Joe Dispenza. There's another person teaching with Mind Valley right now, Paul McKenna. I don't know how many angles of what I do he teaches. Like I say, it is kind of a learning process of understanding how the subconscious mind works.
Mhm,
Joe's got a lot of books written about a lot of
mhm.
the stuff. I've interviewed Ellen Langer. She's the tenured Harvard professor who all of the transformational experts refer to. She's the one who took the population of men who were like in their 70s and half of the group, they went back and reminisced over the good old days. The other half went back and experienced the good old days. And the ones that reminisced over the good old days, they didn't have any change. The ones that went back and experienced the good old days, they got taller, their finger length got bigger, their cognition improved, their agility improved. I mean, all these crazy things in a week.
In a week. So are there certification programs? Do you have to go to a particular school? Like, how do you get certified licensed to say, now I'm a hypnotherapist and I work with the subconscious mind? Have these
Yeah,
kinds of
I'm not a medical thing anymore. I was doing that when I was doing acupuncture, and I've chosen to just do this that I'm doing because honestly, I wasn't impressed with the COVID response. Don't know that I want to
Yeah.
I don't know that I want to be under that thumb anymore. So, but again, I got certified from Marissa Peer, who won the
Okay.
Best of Britain Award. Paul McKenna is doing the stuff through Mind Valley. There are a number of different. When I was in Los Angeles, I had experienced acupuncture hypnosis from two of the top hypnotists there. One guy was famous for helping all kinds of celebrities stop smoking, and the other one had founded Hypnosis Motivational Institute. So they did training as well. That didn't rock my world, though. When I started studying with Marissa, I realized, okay, there's layers to this that I have not been plugged into yet. And so the deeper I've gone with understanding how the subconscious mind works, the better the outcomes have been.
Okay. Okay. Ray, what question have I not asked?
Oh goodness, what question have you not asked? What's next for Dr. Schlafer?
Well, I usually find that the universe brings me the next step.
Mm.
I am very curious about what my friends are doing studying iboga and how that heals traumatic brain injury. And it has a lot of other neurogenic positive effects as well. So I'm going to dive into that and learn more about that. I've been down to Medellin, Colombia, because one of the people that I work with has a whole healing resort down there. They're working with stem cells. So I'm just I'm an insatiably curious human, and I like to find out as many tools as possible and share them. I have a whole reading list on my website so that people can, that needs to be updated. But I love, and that's why I've got my podcast as well. So whenever I come across something that I think is really interesting, I'll put it out on Next Level Healing, which is available on all platforms.
And let's mention, yeah, and also her website as well. We want to put that.
It's, consulttara.com. You can also find me. Yep, there we go. Thank you. And people can just go on there, answer some questions to get clarity about their issue. And then if they'd like to book a 30-minute call with me and just see, I can go through my slide deck and let them know what kind of outcomes people have gotten. And,
You really have a long list of success stories. I mean, she really does. It's incredible with people from all walks of life, with all different types of issues, all coming out of it with a positive experience. It's really, really something, the work that she does. Really
Thank you
is.
so much. If you go on Google and Yelp, you can read a bunch of those reviews. But people with sleep issues, physical issues, autoimmune issues, headache issues. I had one gal that had been attacked by a Rottweiler and went through 6 jaw surgeries and was living in pain and fear of losing more teeth and more surgeries. She had developed a choking disorder. Every time she ate, she was at risk of going to the ER. Yeah, no, her husband contacted me and said, "Can you help her?" So she came in, and after 2 sessions, it just wasn't an issue anymore.
Oh my
Again, this is the subconscious mind going, "You're not safe. You're not safe. The world's falling
Yes.
apart." And if that alarm system, I mean, can you imagine living in a house with the fire alarm going off all the time?
Yeah.
Well, if your brain fire alarm's going off all the time, you just get numb and exhausted, and of course, problems are going to start popping up.
Yes. God, yes. Okay, so for those of you, and I can't imagine anyone listening to this not wanting to check you out, because we all are moving through the world with so many things that can be healed, eradicated. Those alarm systems are going off all the time. But so like, subscribe, share. But I want to ask you one final question that I've been asking all of my guests as of late.
Mhm.
When you get to the end of your life, what will have made it most meaningful, and what do you want to be remembered for?
I love that question, and I just love it. It's making me beam from my heart. Well, I want to have completed my mission. And I'm not sure what that is, but it includes helping people. I think we're here to set examples. I think we're here to be kind to one another, to be patient and loving, not judgmental, because like you said, I often say, we only perceive, uh, let's see, if this is the auditory spectrum, we perceive this much of it. If this is the visual spectrum, we perceive this much of it. So, and then you have the reticular activator system in our brain that's, not seeing all the other things that are available to see. It's like we've got our mental binoculars looking at something. So our chances of understanding reality for the way it really is probably non-existent. So I think we have to go through life with an open mind and be really, really discerning, and the things that feel good, like being kind to another person, doing our best, being humble, being kind to ourselves, getting enough sleep, eating the right foods, getting enough exercise, spending time in nature. Those are all clues that, that's good. We should do more of that. But I do think whatever this is that we're all experiencing, it's probably way bigger than any of us can possibly imagine. So I want to have done a good job of living that path. And I don't ultimately know what that means, but at the end of my life, I want to have done the best I could have done with the cards I was dealt. And I want that for everybody else too.
Yes. Yes. I love that answer. Thank you so much, Dr. Tara.
Well, thank you for asking such beautiful questions. That's the art of, and the test of a good interviewer. So thank you so much. And Ray, thank you so much. You're an amazing human beings. For those of you who haven't read Ray's books, please get them. I recommended them to all my people. I've done webinars with Ray, and his life story is ultra exceptional.
Extraordinary. Extraordinary. Thank you both.
How I Made It Through is produced and distributed by EIQ Media, LLC. Elevate your emotional IQ with podcasts and content focused on overcoming adversity, leadership, mental health, entrepreneurship, spiritually transformative experiences, and more.